Good evening. My name is Bethany Koshinsky, and today I'm going to be talking to you about the Transtheoretical Model. The purpose of the Transtheoretical Model is to help individuals achieve behavioral modification by gearing interventions toward the respective stage in the process. The stages will be described on the following slide. As the title suggests, the Transtheoretical Model was constructed based on a meta-theoretical approach, as it focused on broad issues. The theory was constructed with an integrative approach of various psychology theories from Freud, Bandura, and Skinner, to name a few, in order to link concepts between the vast array of fragmented theories in psychotherapy. The Transtheoretical Model was developed utilizing various social theories in the 1970s in order to understand the process of smoking cessation and an individual's intention to modify their behavior. While the theory was originally utilized in the context of smoking cessation, it has evolved to encompass various behavioral modifications which influence one's health. This is the stages of change. In pre-contemplation, the person is still in denial. In an article by Evers et al., 2006, the participants in the study were not considering implementing positive modifications within the next 6 months. In contemplation, they're starting to consider change with a goal of 6 months or less. Preparation, an individual has decided that they are going to change and has a goal of attainment within the next month. Action, individuals are actively making positive behavioral modifications for a period of time, usually 6 months or less. Maintenance, the change has become ingrained in part of the routine and has been actively integrated into one's life for greater than 6 months. Termination, the negative behavior is not an issue for the patient anymore, and there is lack of temptation. And this is debated, whether this phase is actually part of it. The other concepts are decisional balance, the mental contemplation one undergoes when determining the advantages and disadvantages of change. Self-efficacy is one's belief of their control over a situation, and temptation is the influence to revert back to a previous stage. The processes of change are also part of this theory. So I'll walk through a scenario for you to help you guys understand. Consciousness of raising, I become aware that my excessive ice cream consumption is affecting my health. Dramatic relief, when I found out I have diabetes as a result of my sugar intake, I become upset and ready to stop eating Ben & Jerry's. Environmental reevaluation, I realize that having ice cream in my immediate surroundings in the fridge contributes to my addiction. Social liberation, I realize that this is a problem with ice cream addict, and I hang posters in the school to reduce ice cream and sugar consumption. Self-reevaluation, while I was sad at first that I had to decrease my ice cream, I now feel more healthy and energetic, and my blood sugar is stabilized. Stimulus control, I no longer go to Ben & Jerry's with my friends. Helping relationships, my friends and family understand my problem and don't bring me ice cream anymore. Counter conditioning, I've replaced ice cream with Greek yogurt, with no artificial sweetener and fresh raspberries. Reinforcement management, since I haven't eaten ice cream in 6 months, my family takes me on trips to the beach. Self-liberation, when I go to the doctor and my chronic condition is now under control, I feel empowered and committed to maintaining this lifestyle modification. While there is guidance for the various stages, there is not clear and consistent definition to delineate the difference between the various stages. Since people may differ in their readiness to change, and some may revert back to previous stages, the concepts do not have a set timeline for each stage. The concepts also do not mention a set age range for the model. The model also assumes that individuals have the cognitive ability to make informed decisions. There is no set definition that eliminates people with dementia or mental debilitating illnesses that may not have been able to make conscious decisions. Since the Transtheoretical Model is broad and covers a wide spectrum of behaviors, Prochaska and Valisser, 1997, provide theoretical definitions which can elicit various research studies. The stages of change, therefore, can be applied to various settings. In this theory, the concepts evolve through a process of self-awareness and self-actualization to allow the person to make positive change. However, without introspection or education, the individual may never progress past the pre-contemplation stage, as they are unaware that there is even a problem. Every stage except termination has the possibility of reverting to the previous stage without consistent support through the behavioral modification. While the interactions between concepts are logical, there is not a clear cycle between stages. According to Prochaska and Valisser, 1997, people often relapse to earlier stages. However, while one may be in an action stage and revert all the way back to pre-contemplation, another may go from the action stage to the contemplation stage. While the theory flows throughout a series of stages, it is broad and unique in application to individuals. Therefore, one may not think it's organized. However, the framework is important for interventions it relates to, since there is no set algorithm for behavioral modifications, as people progress differently based on influencing environmental factors. The model, which is depicted in slide 3, describes the various stages that an individual must go through in order to reach their outcome. Unlike traditional theories, which normally define a narrowed outcome, the Transtheoretical Model includes multiple outcomes throughout the process of change. The theory is very applicable to nursing interventions. According to Prochaska and Valisser, 1997, the model assumes that interventions should be geared towards one stage. While the model was originally utilized for smoking cessation programs, it has now widely been implemented in research studies throughout various health promotion interventions, including exercise, sexual health, and use of sunscreen. The theory does not specify cultural norms or socioeconomic factors which may impact one's intention to change. Since the model does not define a specific cultural context, it has been used in a wide variety of settings. With the increasing awareness of preventative medicine and healthcare, the belief of the Transtheoretical Model is immensely applicable to nursing practice. According to Valisser et al. 2000, over half of unexpected early mortalities can be attributed to risky health behavior which could have been prevented. As you can see, weight control, drug use, sexual health, and mental health are just a few of the ways that nurses help influence and utilize this theory. According to the World Health Organization in 2017, depression affected over 300 million people worldwide and is the most significant contributing factor to disability. Levy et al. 2015 applied the Transtheoretical Model to improving outcomes for depression. This article determines the effect of social marketing with the utilization of the Transtheoretical Model to develop websites which disseminate mental health awareness and persuade individuals to engage in depression prevention and seek help if needed. The next article that utilized the Transtheoretical Model is with application to exercise. According to Huang et al. 2015, while heart disease is the leading cause of death worldwide, regular exercise has shown remarkable improvements in outcomes. Huang conducted a study on 130 patients following open heart surgery to examine the compliance to exercise for a sustained 6-month period. Participants were given a questionnaire prior to the surgery and 6 months after to examine their level of readiness in terms of complying to exercise. While gearing interventions toward the individual's level of readiness, the study found at a 6-month follow-up that the majority of individuals were in either the contemplation stage or the maintenance stage, and were moving towards the action stage. After recognizing the detrimental impact of skin cancer, Yusufov et al. 2015 conducted a study of over 3,000 adults by implementing a computer intervention system to elicit change in behavior. They found that the most important factor for change were raising awareness about the negative impact of excessive sun exposure about sunscreen, avoiding the countering stimuli that elicit the problem behaviors, rewarding oneself for making the change, and choosing to commit to believe in one's ability to change. Another study I found, which is shown on the background, was the use of UV technology to help individuals become more aware of the damaging effects of not using sunscreen. The person on the left doesn't have the UV light on yet, so her skin looks relatively clear. On the right, though, with the UV technology, you can see that her skin is significantly damaged. And they found that children, even as young as 2, can show signs of skin damage. Well, currently the theory has been researched primarily in behavioral modification strategies, from healthcare provider interventions at visits to public health announcements. The theory is on the brink of significant change. With the advancement of technology and continuous feedback from electronic devices, patients will have increasing awareness of their current health status. One app in particular was created by the Heart Failure Society of America, 2018, and helps track medication compliance, symptoms, vitals, exercise, diet, and mood. This app also has the technology to sync to the provider. Maybe with this up-to-the-minute feedback, the patient will be more willing to change quickly. According to Vlisser et al., 2008, the theory was originally developed to integrate various theories. However, new constructs can always arise and will need to be tested, resulting in the need for modification of the model. PM Omajar helped develop a video game technology to improve compliance for cancer treatment. Hope Lab 2018 found the original remission game improved treatment adherence and boosted self-efficacy in young cancer patients. The study utilized fMRI technology to demonstrate the positive impact that games had on the brain to produce behavioral modification. Since technology continues to evolve, this will be a new form of counter-conditioning. However, the efficacy of the technology will need to be studied. For example, in this model, there would need to be more clear definition in terms of age. Do children and young adults differ in the stages and processes of change, and their consciousness and awareness may not be developed as much? Also, for a younger adult, is the process shorter in duration since habits may not be ingrained? Other factors which would need to be considered would be influencing socioeconomic factors limiting the treatment. Biologic factors would also need to be considered, such as predisposition for depression and anxiety, as life-altering events such as cancer could impact one's willingness to comply with treatment. While the transtheoretical model is broad and does not specify a specific culture or population, it may be important to consider the political structure of one's environment. In America, we have a freedom of choice, but this theory may not be applicable in a dictatorship where people do not have a choice over their behaviors. While this theory has helped lead the way for various evidence-based studies to date, as science and technology evolve, the theory may need to be modified. I thank you for taking the time to listen and learn more about the Transtheoretical Model. Here are my references. If you have any questions, please reach out.